Hello, everyone. Today we welcome Dr. Fran from the Lowdown onto the podcast. This is going to be a smashing conversation because I know you guys have been waiting on this. You've been waiting on this topic. So many of you won't know who Dr. Fran is. So, quick intro, Dr. Frances Yarlett. She is one of the team members at the Lowdown. So when you search for it on the internet, there's another website that does the lowdown and it's all about cars and I don't know, car rings or whatever. But this one is thelowdown.com. They're in the UK. They specialize in hormones, fertility, women's health. Dr. Fran is also a GP. So she is practicing, she's helping women as much as she can on her end. And she, after much annoyance from me, agreed to come on the podcast to discuss birth control and contraception and all the questions we kind of have around that. So thank you, Dr. Fran.
Absolute pleasure to be here. As I said, once you set me going with some questions, I won't be able to stop. I'm really excited to share everything with you.
We have loads of questions because this, as I mentioned to you before we started recording, there's clearly a big movement happening now in women's health
Hmm.
everywhere. Not just in Canada where I am, the States, but the UK as well. One of the bigger groups, the estrogen dominance group, I don't know if you're in it or you're aware of it. It's ran by Kitty Martone, but I believe it was started out of the UK and they have I don't know, 50K members or something now. And people want to know like everything. Like, why have
Absolutely.
I been
Yeah.
lied to? Why am I not getting the answers I want? Why am I feeling so bad? What caused this? Just again, women's health, there's a huge movement. So when it comes to contraception and birth control, I was like, okay, we got to get someone good on to fill in the gaps and answer the questions. And I was directed to the lowdown by Dr. Geraldine Pryor, who's at the
Hmm.
University of BC, and I think she was on the lowdown before in her podcast. But that's where I was like, all right, I'm all over this. I'm going to reach out to these guys. And here we are.
Yeah, well, thanks for reaching out. For those of you who don't know us, at the Lowdown, we believe in listening to women. We believe in the stories that women tell us rather than what the textbooks are telling medics. So what we do is we've spent 5 years collecting all of your stories and your experiences on birth control and with female reproductive conditions like PCOS, endometriosis, fertility, and perimenopause and menopause. And the reason we're doing that is exactly as you say, to fill in the gaps that we are so far being let down on in research in women's health so far. So that's what I do. I listen to women's stories and then I try as much as I can to help. And I strongly believe that actually one of the biggest ways we can help as doctors is listening to what you have to say and validating your experience.
Yeah, which is a big thing. I always say, like, Canada has universal healthcare. It's completely different to what Ireland was like. The healthcare here, in my opinion, is atrocious compared to Ireland. There's no listening. You're in
Mm,
out 5 minutes, they barely know your name. You're just on a list. That's all it is.
yeah, yeah.
So then women are either getting refused what they're asking for, or they're just being told you just have anxiety or you just
Mm,
need to the usual exercise more or whatever. So women, of course, are frustrated.
yeah, absolutely.
And you're the Lowdown's website, just to kind of circle back on why it began, I believe the founder, Alice, she
Hmm.
started the Lowdown because of all her issues with contraception and how that then influenced her fertility journey down the line.
So Alice has endometriosis. That's the first thing she will always tell everyone. So she founded the Lowdown. I was the first doctor, the first person she hired to come on board with her. And she decided that she couldn't find the information she wanted, which is how does birth control make you feel? Am I crazy or is this my pill? And why can I not find out the information about the different side effects that are happening to women from birth control? So she set up the platform where women can share their own side effects so other women can learn from them. And, we're not anti-birth control in any way, shape, or form. We're the right one for you. That's what we're all about. And Alice went on this long journey where She really struggled with pills. She found that made her very emotional, gave her really bad mood swings. And then eventually she found the hormonal coil, which is a very low dose of hormone, which gave her the balance of being able to treat her endometriosis while giving her the least side effects that she could find. So that's why we came about. That was Alice's story. And then when she started her journey to get pregnant, she's very open about talking about how worrying it was for her, given that she has endometriosis. And the first time she fell pregnant, she actually had an ectopic pregnancy. And it's very difficult to know why that happened, but we do know that endometriosis can increase the risk of that. But then thankfully, she has since gone on to have two beautiful little boys. She welcomed the last one just a few months ago. So she's currently off on maternity leave. But that's the other thing we like doing, sharing our own stories in women's health, because it makes us more relatable on the platform as well.
Absolutely. We want to hear from other women. We want to hear experiences. We want to be educated. And I think a lot of women, as much as we understand, there are some great male doctors that are caring and do want to help. At the
Mm.
end of the day, they'll never be able to relate to a woman and her experiences the way another woman will.
Yeah, and I completely agree with that. That's why there are a lot of us in the UK now who are so passionate about trying to make this space better for women as women. And it's it's improving. I do think it's improving, but you have to go to the right place. You have to find the right doctor who's going to be that advocate for you.
Yeah, and you have to understand, which is where these podcasts and your website comes in. You have to understand how it works and what you're asking for so that when you do find this doctor, you can advocate for yourself. You can request the correct tests or ask the correct questions. Could this be right for me? What do you think of this? And that's education is so important. And I think that's what we were lacking from the early 1900s, where women were silenced for a lot of the century and then drip, drip, drip of education. And now we're almost getting bombarded with education.
Yeah. Yeah, almost. And that's why you need to, go to reputable sources for your information to make sure it is something which is clinically true. But totally, I mean, early in the 1900s, we still talked about hysteria as the cause for everything. And have you discussed that before on the podcast? Hysteria literally comes from the word to mean womb. And they were like,
Yeah,
you're hysterical because of your womb. Isn't it
okay.
awful?
It's crazy. Like you have to kind of laugh. We've kind of had a hard time over the last few
You
centuries.
think? Yes, we
Dr.
have.
there's Dr. David Rosensweet over here. He was one of the pioneers on this side of the world, bringing bioidentical hormones to the forefront. And he was talking about how there used to be like these menstrual quarters that women would be shuttled into whenever they were menstruating, just so they were left alone to deal with their emotions and everything.
Oh, it's
So,
mad, isn't it? It's almost
all
like women aren't allowed to feel. We're not allowed to be emotional, isn't it?
yeah, I think though, I'm sure there's people laughing, a lot of us going, well, that doesn't actually sound too bad nowadays. Just leave me alone for a week.
Yeah. Getting away from life.
So let's get into the birth control topic. There's a lot of talk around birth control in my group, in more of the perimenopause aspect of
Mhm.
using birth control to manage perimenopause symptoms. And then when these women start to learn, okay, it may not be all it's cracked up to be and maybe not such a good idea, then they start saying, well, hold on, what about my daughter? My daughter was just recently put on birth control. So, birth control is not just one age group, it's spread across the whole range for women when you're cycling.
Yeah, absolutely. And I feel like there's a lot of rhetoric around birth control. We hear a lot in the UK, people, young women aged between 14 or 16, I got put on the pill. And that sentence, I got put on the pill. If you listen to me, like, well, where's the autonomy there? Rather than I chose to go on the pill. And I think that's one thing we need to change. For a lot of young women who are struggling with heavy menstrual bleeding, struggling with acne, struggling with PMS or PMDD, birth control can be a really great option to manage those symptoms. But it's about the autonomy of them having chosen to go on the pill or chosen to go on a birth control rather than been put on it, which needs to change. Um, and you also have to wonder about the consultations when someone is started on contraception. So if I do one, goodness me, it would take me half an hour to do a proper consultation of discussing all the risks, all the benefits, all the side effects, how to take it, which brand to choose, etc. Whereas in the UK, at least, we're shoved into 10 minutes, and now it's even being pushed out to pharmacies for pharmacists to do. And I think unless you're well informed about the aspects it can have on your health, you can't really make an informed choice about it, and that's what we need to work on. So that's young people. I was put on the pill. And the other thing is, as you're going through your reproductive life, birth control, your needs and your wishes, they change. They change so much. Like, we see a lot of women getting through the mid reproductive area where they think, I'm done with hormones. And some people say, oh, this is hormonophobia. People are so off hormones. But actually, sometimes women are just done with them for a while. Just think, I just want to not have them. And then you go into perimenopause and menopause, and that's when the time you think, gosh, my hormones are all over the place. Now I need some support. But it's knowing that it's not one size fits all, and it's not the same for your entire reproductive life. Like things change, you change, your hormonal profile is completely changing, how it reacts with birth control is completely changing. And don't be afraid to have the discussion again and over again if you need to, if you're not happy.
Mhm. I think a lot of experiences here for young girls who generally will go to these appointments with their moms. Their moms
Mm,
speak up for them, explain she's experiencing the cramps, the menstrual pain, heavy bleeding, she's missing days of school. And that's the end of it. The doctor
mm,
will write something down and hand them a prescription.
mm,
There is no consultation. There is no question and answer section. There is no, here are the pros, but also here are the risks. Here are your options. There's none of it. It is, you tell me your problem, dot, 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 here you go. Like that is the
yeah.
experience of a lot of women. So, and I would argue, and this goes back to the education part, a lot of women and young girls don't actually realize that the pill or birth control is hormone. It is hormone therapy. They think
Mm,
this is just some sort of medication.
mm.
Again, they're not being educated that this is hormone therapy and this is going to influence your hormones, not just now, but in the future as well.
Yeah, and I mean that's why on the lowdown we have the everything you need to know about guides, which list everything you need to know to make these choices. Because if you're not informed, you can't make informed choice. It's so important. And I mean, I could rant at you now for like an hour about everything you need to know, but it's so hard to keep it in your head. So that's why it's good to be able to go back to it and remind yourself every so often. If you feel something or you have a side effect, you're like, oh, is that my pill? You can go back and readdress and have a look. So things like that, it's really important. It is really important that you know and you understand what's happening. Um, you know, birth control does have huge benefits, but it also has some small risks that you need to be aware of. And if you, God forbid, are one of those really unfortunate people who has one of the adverse effects, you need to have known about it to say that you had informed choice.
Yeah. Now, let's talk about the risks. Are you referring to risks just in the younger girls in the interim, like in the present time that they're taking the pill, or are you talking
Hmm.
about risks in the future tense, like what they can experience in the future, whether or not they are going to have challenges with hormonal imbalances or estrogen dominance or whatever you want to refer to? Like I suppose context is important here.
Yeah, well, so we know there are some very small risks when you're taking hormones, and it depends on which hormones you're taking. So, if you are on, for example, a combined or combination pill, that contains two hormones, estrogen and progestogen. And most of the brands available are synthetic hormones, versions of those hormones. Um, and the main risks that you should know about are number one, very small increased risk of blood clots in the legs and the lungs. And you'll hear quoted like 4, 6 times higher. And that sounds really scary, but actually the numbers are still very small. So, for example, walking around day to day, a woman's risk of having a blood clot is about 2 to 5 out of 10,000 women per year. If you take a combined pill, that increases ever so slightly. And if you take one of the combined pills, which has got the highest risk of blood clots, it still is only increased to 9 to 12 out of 10,000 women. So it's not a huge risk, but you need to know about it.
Hmm.
You need to know about it. The other risks are a very small increased risk of having high blood pressure and even an increased risk of strokes and heart attacks, which is why your healthcare professional should take a really good history from you to see if you have any risk factors for heart disease or stroke already, such as you smoke, your BMI is high, over 30 or 35, if you have family history of any problems, or if you have migraines with aura, which is where you get the fuzzy lines with your headache. Any of those things mean that the combined pill may not be as safe for you, and so you shouldn't be allowed to have it. Um, the other risk we always need to talk about is the risk of cancer. So for younger women, there is a very small increased risk of breast cancer if you take the pill, the combined pill. And a new research, actually, if you take any form of hormonal contraception, including the progesterone only, there's a very small increased risk of breast cancer. As women get older, you're more likely to get breast cancer. So the risk increases as you get older anyway. But when you stop the hormonal treatment, then that risk goes back down to normal, although it does take a while. It does take 5 to 10 years for that risk to go back to the sort of baseline population breast cancer risk. Um, Also, a very small increased risk of cervical cancer, which is why, ladies, you go to get your cervical screening. You must go because that will pick up any small changes if you need treatment before it develops over many years into a cervical cancer. But what we don't often tell you is, because everyone talks about the scary, terrible risks of birth control, is that the combined pill is actually protective against ovarian cancer, colon cancer, and womb cancer. So, you have to have that discussion and that balance of risks to say, okay, slightly increased risk of this, but I'm protected more against these. Um, so they are the sort of main current risks as you're taking the pill or other types of progesterone-only contraception. Now, when you stop taking them, we talk about things like estrogen dominance and hormonal imbalance. It's really, really difficult to put a clinical medical diagnosis on these things because there hasn't been much research to sort of validate them as diagnoses. We do not know how being on hormones can impact you later in life with your hormonal profile. We do not know. There's been no research. What we can look at is like fertility rates, because your fertility is a really good indicator of how your hormone and how your menstrual health is. And we know that for the majority of women, when they stop hormonal birth control, your fertility is back to your baseline within 1 to 3 cycles. And when I say your baseline, that's really important because I hear over and over again, and I'm sure you will as well, that women have been on birth control for 10 years, they've stopped birth control, and suddenly they have all these symptoms and get diagnosed with a condition like endometriosis or PCOS. But what we have to tease apart is that the hormonal birth control, or is it that the condition was always there and the hormonal birth control has been treating that condition? So the symptoms have only come out when you've stopped taking it. And that's a conversation I have a lot with women about this, the fear that is, has it been the birth control that's caused it? And I say, well, actually, it's probably something that's always been there, but the birth control has actually been treating it. A lot of women use the word masking it, but I prefer to say, well, it's treated it because it is a treatment for those conditions. You've stopped the treatment, the symptoms have come out. We do not know the cause of endometriosis. We do not know the cause of PCOS. We just don't know the main causes. Can we say that absolutely nothing to do with birth control? No. But can I say that the birth control has caused them? Absolutely not. It's one of those things which is in the minefield of women's health that we still are trying to work out. Does that make sense?
Yeah. So could it be also, though, that the condition was already underlying and the pill, whatever pill you were taking, could have exacerbated the symptoms because it overactivates the estrogen response or estrogen receptors. As I know there is an argument out there now by a lot of health practitioners and many reputable doctors, um, alluding to that these young girls, and we're still on the young girls aspect, they already had issues with their estrogen for whatever reasons. Maybe it was hereditary, maybe there was some trauma at a very young age, or whatever it was. Um, and that maybe they should never have been put on the pill because they hadn't dealt with the underlying condition that was already there. So then when they do go on the pill, it exacerbates the issue.
But the thing with that argument is we don't have any clinical evidence to support that argument. We do have clinical evidence to show that if you have heavy periods or if you have endometriosis, if you take hormonal treatment, it improves the symptoms while you take it. We do have clinical evidence for that. We don't have any clinical evidence to show that some young women have these issues and then starting on hormones is exacerbating it. We don't have any clinical evidence for that. So we just can't say it. All we can say is you have to choose what is right for you at that moment in time. So, I think you have to have a really open conversation with your doctor and say to them, if I take this, will it make me worse in the future? And the honest answer is, well, we don't know. We just don't know. We can only tell you what's going to happen right now. And if you have a condition, for example, like endometriosis, to formally diagnose that, there are better imaging techniques coming in now, but to diagnose it, you have to have an operation under general anaesthetic. And the waiting list in the UK for that is 18 months, 2 years maybe. And then these women, you say, what's your choice? I can give you something to help you now, or you can wait for 2 years with nothing to help you. And when faced with that choice, it's a difficult one because it's almost like no choice, isn't it? It's almost like you
Yeah.
want me to stay as I am in this
Yeah.
crippling pain and with these awful symptoms.
Mhm.
Um, but that's what we do. We have to give you the informed choice and say, look, this may help you. There's evidence this helps you. How it's going to deal with what's going to do in the future, I don't know, but I know that it will help you now.
Yeah.
Um, so that's the conversation I have with women. It's about being open about what we know and also what we don't know. And I think that's really important conversation in women's health that we don't know as much as we do about many other medical conditions. So rather than, just shutting it down and saying, obviously not, we just have to say we don't know. There is no evidence for this, but there is evidence for this.
And I think,
Um,
I'm sorry to interrupt. I think
yeah, yeah.
that's the challenge, though, isn't it? Because the other side of the argument is, yeah, there's no clinical research because women's health has not been taken seriously for
Mm,
so long. So we're lacking in that area. So we can't confidently say yes or no. And then you're right. And I speak to women all the time. Oh, well, what's the alternative? You just suffer and stay. Like, I can completely understand why women choose birth control. I
mm,
luckily have not had to be in that position where I was on birth control very young because it was the norm back in Dublin back then. Again,
yeah,
you were just put on it. But uh, now I haven't been on it for a long time, but I'm lucky in a sense I don't have menstrual issues. It comes and goes. I laugh, I say I could stand on my head. It would not make a difference. I'm
yeah.
lucky. But I speak to a lot of women who just can't leave their house, can't leave their bed. They're in emotional wreckage. So, although we're aware there's potentially risks, we also understand you need to have a quality of life as well. Like, it's a
Absolutely.
catch 22. And then to further the conversation, the more we talk about women's health and we bring out these different views, a lot of women then start to feel guilty over their choices, which I definitely don't want. Like, if you're in
Yeah,
agony, if you are having very heavy bleeds, if your quality of life is just almost zero, don't feel guilty. Of course, we can understand why you would make
absolutely not.
that choice. And
No,
yeah, so you choose what you can. In the interim, you educate yourself and then start to consider, is there maybe another option?
absolutely. And you should never feel guilt. You should never. judge other women for their choice because you're not walking in their shoes and you're not living in their life. And you should never shame or tell other women what they should do. And to be a good doctor, you should also not tell women what to do. To be a good doctor, you should present women with all the different choices,
Mhm.
all the information, and allow them to make their own choice. Women are not stupid. Women are able to make a choice that's best for them. And even if a doctor thinks, well, that's a stupid choice, that doesn't matter. It's not our choice. It's your choice as a woman. So you have to be educated. You have to balance the risks and the benefits to you, and then you make your choice. And that is the most important thing with birth control is balancing the risks and the benefits. Because we've talked about the risks, sounds terrifying, but the benefits to an individual can be phenomenal. We have this is the great thing about the Lowdown platform. We have people who have rated some brands of pill like the worst thing. I would never take this, made me awful. I can't, it was disgusting. I hated every moment on it.
Mhm.
Then you have other women who are saying, I had PMDD. I could not get out of bed. I thought I was going to harm myself. I'm taking this pill now and I have my life back. So that is why it's so important to listen to women's experiences because we are all so different. That's the
Yeah,
thing. And what works for one person doesn't work for another.
there's so many bio individualities, and as
Mm.
well we can look at these different testimonies and the education, but at the end of the day, if you decide this is something you want to do, you also have to listen to your body. If your body starts reacting bad, it doesn't mean you stick with it, and or as women do, we just push through. You
Yeah,
have to
absolutely
listen
not.
to your body, and hopefully you can find a good doctor or practitioner to help you with other
Yeah.
options or guide you.
Yeah, absolutely. I mean, with the hormonal birth control, like there are loads of different options. There are so many options. And I try and encourage women to try for 3 months, to try an option for 3 months. But if you come back to me within 2 weeks and you say, I cannot do this,
Mm.
then we'll change it. There are lots of different ways of managing side effects and how you feel with changing things up. There are some birth controls now with body identical estrogen in rather than synthetic estrogen, which suits some women more. Some women prefer progestogens that are androgenic. Other women prefer progestogens that are anti-androgenic. So we can work it around what a woman is feeling and their side effects, but also know that your side effects can change. So if you've chosen a particular form of hormonal treatment, like for example, you are on the implant, you have the implant in your arm, and you've been fine for 3 years, you get another one put in, and then suddenly you just will not stop bleeding. Do not feel like you have to stay with it. If your side effects change, go back. Because as you know, your hormones are changing all the time as you get older. And that interaction with the synthetic hormones can then cause different side effects. So go back, talk it through, see whether there's a different option or whether maybe another option is the right way for your management of your condition or how you're feeling going forward.
And it's also what you said, it's not that it's not necessarily working anymore, it's that your body has changed. And just
Mm.
like as we speak about nutrition as you get older, like it's going to change. You know that old saying, like women are like, I don't know what happened. All of a sudden, I gained 10 or 20 pounds, but I changed nothing. Well,
Yeah,
that's the
yeah.
problem right there. You didn't change anything, but your body was changing at the same time.
Yeah,
So
absolutely. I mean, if you think about it, like women's bodies are incredible, how much we change. It's incredible.
I sometimes I
Stressful.
just laugh. I'm like, I had two kids. How am I still walking around? Like, that was insane.
I know, right? I know. Everyone thinks that I hate the postpartum thing, like bounce back, get yourself sorted. Gosh, it takes so long.
You're not the same. I was just
No,
thinking. A woman is not the same when she has a baby as she was before the baby. You will never be the same again, regardless of your age. You will never be the same person. It changes
no,
you on so many levels.
yeah,
A man can never comprehend what we
no,
go through ever.
no. And I think that's one of the hardest things you have to try and get across to sort of a male partner or the father of your children is that you just don't understand. You don't understand what this has done to me. to
Oh
bring
yeah.
life
Like
into this world
I
for
was
us.
having this conversation with a guy in the gym yesterday who recently found my podcast. He's like, I found your podcast. They're great. I sent them to my wife and he's like, I know you focus more on like female hormones and health and stuff. And I was like, But no, you should listen to them too,
Yeah,
because a big part of the problem in society, I believe, especially as divorce rates keep going up, is that as women are changing and we're going through all these experiences, the men don't understand either.
yeah,
So they just think
absolutely.
that we're complaining or we're always arguing. But at the same time, we get fed up trying to explain ourselves and justify what's happening, and then it all just implodes. And that's why we see the higher divorce rates in those perimenopause, menopause years, because
Yeah,
women are like, I'm done with this. You're not listening to me. You don't understand me. And then, of course, on the other side, the men, because they're just so very sub-level orientated sex food TV. No offense, men, but you don't see things the way we do. So you take it very personally as well. And again, I'm just trying to say, I think men need to know this as well, because it's not
yeah.
just, oh, she's on her period, leave her alone. Like it's not
Oh,
anymore.
no, it's so much more. It's, oh, she's on your period. Oh, are you PMSing? Is it the time of the month? I hate that. It's one of my least things. And if men only knew what women did to their bodies and what we have to go through to prevent pregnancy, to be more convenient for them, I mean, come on, they would be wild if they had to put themselves through what we do.
They wouldn't be able to. That's why God made us superior, obviously.
Yeah.
But like,
Yeah.
it, they know we have a period. I don't even know if men know about PMS, to be honest. But they're like sitting down watching TV going, "Oh, she's on her period. She's bitchy. Leave her alone." They don't know that we're probably up in the room going, "What's wrong with me? Like, am I losing my mind? Like, I
Mm,
hate feeling like this." And we're trying to deal with all of this emotions and maybe at the same time guilt for raising our voice at our husband or our kid. Like, it's a lot for women. You can understand why a lot of
yeah,
women get so overwhelmed. You're like, what the hell is
absolutely.
going on here?
I think my advice to women would be to constantly drip feed this to your male partners. So I have been on like a 10-year training course with my husband, constantly dripping him about women's. We have two daughters now, so he needs to know. He needs to know about women's health. But I've never been prouder than when I'd had my first child and I went on a new pill. I'd never had this pill before. It was desogestrel, which is a synthetic progestogen. I went on it, and 10 days in, I was standing in the shower hysterically crying. And he went, Fran, do you think it might be the pill? I was like, oh my gosh, you're a hero. You've noticed that. Isn't that amazing? That
Yeah.
shows what can happen and how they can support us when men are also informed.
I think a little bit more challenging for those of us, which would be me and a lot of other women who are just all boys. Like I have two boys, and it's just it's harder for them to understand. But let's just go back to the birth control. So the oh, I forgot what you said, but the insertion into your arm, the
Oh,
little
the implants.
yes,
Yeah, yeah,
the word
yeah.
wasn't coming out. The implant is not so common in Canada. It's like rare I come across it. It's not as common as
Oh,
it is in
really?
Ireland and the UK. What's more
Yeah,
common here is going to be the IUD, which you guys more refer
yeah,
to as the coil, and we would
yeah,
call
yeah.
it the IUD. So that's quite common here. What do you think? What are the kind of common pros and cons around the IUD? So not touching on the copper one right now, just what we would call the marine or the regular
Yeah.
IUDs.
Yeah, yeah. So the hormonal IUD. So can be a great option for many, many women. They are in the UK, the first line treatment for heavy periods because they can reduce how much blood you lose by 90% after you've had it in for a year. It's a low level of hormone. It's a synthetic progestogen. It's androgenic, which means it has more effect on male hormones. So some of the side effects that are common are like acne and things like that. And because it's inserted in the womb, it's meant to only have a very low level effects on the rest of your body. However, I know that's not true because I've had three in and I know that I get side effects all over my body. They do tend to settle, but the things it can do is make PMS worse for a little while. It can cause spotting and irregular bleeding until it's settled for 3 to 6 months. Um, so, but some women find it life-changing because if you're flooding and passing clots and anemic from your heavy bleeding, it's amazing at reducing that. But it is not for everyone because I hear from as many women who love it that hate it and say, no, I just felt awful on it. It's not for everyone. But you can also get it in varying doses. So you can have a Merino, which is the higher dose one, and even that's a low dose. Then you can get even smaller ones, which only last for 3 years, which have even a lower level of hormone released in your body. And one of the good things about it that I like to counsel women about is actually if you're still wanting to feel your natural cycle and feel sort of the ebbs and flows through the month, then the hormonal coil only suppresses ovulation, so only suppresses your cycle in about 1 in 5 women. So 4 in 5 women who have a Mirena will still release an egg every month, even if they might not bleed. And that's because it works by thinning out your womb lining. So if there's not much womb lining, you can't bleed, but you can still release an egg. So you're still feeling that natural hormonal shift in your body every month, which a lot of women really like. Um, but downsides and risks, as I say, side effects, not for everyone. The risks are mainly the insertion, and people go on and on about the insertion. So pain, and I know you'll want to talk about this, Shemaine, because the pain for women's
So
procedures.
invasive. It's just like the
Why?
pap. It's just like
Yeah,
every.
like why are we not?
Why are we always getting
Anyway,
poked?
yeah. And my husband says to me, oh, if I had a vasectomy, you'd have to knock me out under general anesthetic. I was like, oh, really? Okay. Two C-sections, three core like fitting with nothing. But the UK have actually been really quite forward thinking in this, in that we have new guidelines came out recently to say that every woman needs adequate pain relief for coil fittings. So now we use a local anesthetic spray, which is far better than the gel that they used to use. And coil fittings are a lot more comfortable now, which is good. But there's still a small risk, about 1 in 1,000 of the coil actually putting a hole in the womb, and there's a 1 in 20 chance of it falling out. So they're the main downsides. And also a small chance of infection getting in there, which can be an infection that makes you very unwell with a high temperature, needs antibiotics, or it can affect your vaginal microbiome. So then you can get recurrent sort of BV, bacterial vaginosis, which is an imbalance of the vaginal bacteria, or thrush, or some women even get like recurrent UTIs from vaginal dryness. So if you're getting those, you then need to support your vaginal microbiome, which you can do with definitely non-medical things like lactic acid, pessaries, and sort of probiotics and things like that. So that's the coil in
Those
a
are the
nutshell.
last few are one of the more some of the more common things that I get approached with from clients. And full disclosure, only people that are having issues are coming to
Yeah.
me. People who are
Mhm.
not healthy are coming to me. Well, sometimes they do, but in general, obviously, I'm going to see higher rates of issues because
Yeah, yeah.
that's why they're coming to me with. But the increased infections is really common. Some women, a lot of pain. Some women don't feel it at all.
Mhm.
Then the heavier bleeding is quite common. The weight gain, migraines is a big one that I see with women with IUDs. Probably the biggest obstacle, believe it or not, here in Canada is when women want it taken out, they actually get told no. They're told no, the doctor will refuse to remove it. So either I've had women just take it out themselves. They've found the string and they've pulled it out, and that is no lie. Or they've
Oh,
gone to another doctor. The other doctor agrees, except they won't do it on the spot. They have to make an appointment. So then maybe they're not getting it out for another 2 months. So they continue then with the chronic migraines, the weight gain, whatever they're experiencing. But that is the biggest obstacle. Doctors
yeah.
here are saying, no, I'm not taking it out, which
I
is
mean,
scandalous.
I can't understand why. I just find that absolutely baffling, and I think anyone who is in women's health would find that unbelievably baffling. The only reason to not take out a hormonal ID is if you've had sex without a condom 7 days before, because there's a risk of unplanned pregnancy. But if a woman still says to me, "I do not care, get it out of me," that's their choice, isn't it?
Well,
That's their
that's it.
choice.
I'm like, it's your body. How dare they say no to
Yeah.
you?
But
But
I wouldn't recommend taking it out yourself at home, just because if you do cause any bleeding to your cervix, which is the opening to your womb when you pull it out, man, it can bleed a lot. and put
Yeah.
you in shock.
I
So
mean, obviously
please
we don't
don't.
recommend it, but women do it.
Yeah,
Women tell me all
which
the
is just
time they do it.
another symptom of how women's healthcare is just not being addressed and women aren't being listened to.
Yeah, we're not being like, if a doctor said that to me, I'd probably be arrested. How dare you?
Yeah,
Like,
it's my body. You can't force me to have this. And yeah, that's really poor. If that's happening to any women, I'd go to the press because it really reeks of like, the bad start of contraception and how women were being forced to do things without wanting to. It's not great.
so as we kind of mentioned a few times, as women transition to through life and we get older, the hormones changes, generally progesterone declines, estrogen increases, and that's where women start to have a lot of these perimenopause symptoms that maybe if
Hmm.
they weren't on birth control before, like ever since they were a teen, now they're getting offered it to
Hmm.
manage perimenopause symptoms. So,
Hmm.
what do you have to say around that?
Well, I mean, again, it's a personal choice. There are some women who want to choose birth control as part of their hormone replacement therapy or you call it MHT over in Canada, don't you? Hormone therapy. Um,
No, just HRT, and then if it's bioidentical, then it's BHRT.
Yeah. So it's the Americans call it MHT, isn't it? So you can use birth control as part of your HRT. So if you are having sex, there is still a chance you can get pregnant, even though you're perimenopausal. A lot of women don't realize that. But women over 40, if you're having sex regularly, there's still like a 47% chance you're going to get pregnant in a year. So it's not insignificant. So you still do need some form of birth control if you do not want to get pregnant. And things like the hormonal IUD, so the Mirena, can be used as part of HRT, with then the body identical estrogen being used as well as. And that can be really good for women who are having really heavy bleeding with perimenopause. And it also means that the dose of the estrogen can be changed quite easily because you just need the one coil in and it can last for 5 years as part of your HRT when you have the coil. There are other regimes of HRT where we can use certain pills to be part of the HRT. So, for example, one brand of progesterone-only pill, which we have in the UK, called desogestrel, can be used off license as a double dose. Also, a brand called Slind can now be used off license and being taken in a different way with no placebo pills can be used as part of HRT. But that's all quite complicated. Like you need to talk that through with a healthcare professional. Some women just say, hey, do you know what? Can I have the combined pill? Because I don't think I want HRT and I'm used to the combined pill. I've had it before. I'm like, yeah, sure. But actually, the combined pill may have slightly more risks and doesn't actually treat perimenopause as well as HRT. So we know that HRT is better at treating hot flushes. We know that HRT is better for bone health and for cardiovascular health than the combined pill. So they're the choices you have. Yes, you can go on the combined pill, but HRT is probably better. You just need to have the contraception with it if you're going to have sex, which can be condoms. It can be anything you want. It's just knowing that you need it.
I want to come back to the whole sex pregnancy over 42 because it's a conversation I had with a client this morning, and I was like, I'll
Yeah.
put it up for you on the podcast. But does where does progesterone come into this? Because you mentioned estrogen a couple of times, and I know there's a lot of reputable people, Dr. Geraldine Pryor, Dr. Katarina Dalton. There's many specialists. You probably don't know Carol Peterson. There's a lot of people out there who would disagree and say, no, this is just progesterone therapy is all we need. But the doses may be higher depending on the woman. So, like Dr. Geraldine Pryor is a minimum of 300 milligrams of bioidentical progesterone to address the heavy bleeding, the hot flashes, the night sweats, and so on and so on. So, where does progesterone come into this?
It completely depends again on your symptoms and the type of progesterone you want. So body identical progesterone, which is the same as the one that our own body produces, is not a birth control. We don't know that it can prevent pregnancy. So if you're having that type of progesterone, you still need birth control. And you're right, when you go through perimenopause, your progesterone decreases. And so some people, I have some patients who just go on a progesterone pill and feel better. The thing with estrogen is it goes high, but it also crashes down low. So in perimenopause, it's all over the place, fluctuations going up, down, up, down, up, down. And that's why some women like to have the estrogen because it just stabilizes the levels in your body rather than having those really high peaks and then like plummeting troughs, which can give really bad symptoms. But it's again, it's something that is individual. It's based on you and your symptoms and how you feel and what's affecting you the most.
I know I brought this up. So my mentor is Dr. Michael Platt. He specializes in bioidentical progesterone and hormone therapy. And I've had this discussion with him, and I brought it up with a few of my other colleagues too on using progesterone only for birth control. And they, like, nobody has tested it because nobody's willing to take the risk. But they
Exactly.
said, like, theoretically, if the dose was high enough and it was continuous through the whole month, and if it was applied vaginally or locally, that theoretically it would work as a birth control. But again, nobody is willing to try it and take that
No.
risk, so we don't know for sure.
Yeah. You know, we know synthetic progestogens work as birth control really well because that's what a lot of birth control is, synthetic progestogen. But it's the natural body identical one. We don't know. And actually, we use body identical progesterone in fertility treatment as well. So we know that a little bit of it helps with fertility. Do we know whether high doses of it suppresses your fertility? Theoretically, but we just can't go giving it out to women unless we know, can we?
Yeah, nobody's willing to do that. Like,
Mm.
what do you do if it doesn't work? You
Mhm.
end up pregnant. But uh so back to the birth control, I had a client this morning. She's early 40s, and um, she was asking about the pill and what I thought and what are the options. And I was mentioning, well, you also know, like, for some reason, people have forgotten about condoms. Condoms work, they're like 99% plus effective. And then I said, there's also the pull-out method, but if you're just like, she's recently separated, so if you're just starting to sleep around with not random men, but you know, you're back on the dating scene. You're the kind of pull-out method doesn't work too well. Like, it's not the best.
And it doesn't protect against STIs.
And that's what I was saying to her too. I was like, even the pill will not protect you against STIs either. So you need to be aware of that. And then I was like, well, at the very least, track your ovulation. You can use ovulation strips, take your temperature. So at least you'll have some awareness if there is a chance you could get pregnant. And then I mentioned to her, it would be my preference if you were going to go on some sort of birth control that you would go on the copper IUD, so we know we're not interfering with the hormonal cycle. You're still going to be ovulating. And that's generally what I recommend if someone is going to go on the birth control. The copper IUD would be my preferred form. And another client wanted me to ask your opinion about the copper IUD as well.
So, funnily enough, I'm going to go get the copper IUD on Thursday. So, the copper IUD, great if you want non-hormonal. It's highly effective. It's non-hormonal. It can stay in for up to 10 years. Great. You still got the small risks of insertion. So, like 1 in 1,000 risk of room, 1 in 20 risk of falling out. There is no toxicity. There's just no evidence for that. You know, the small amount of copper in a copper IUD is not going to affect your body. What it can do is make your periods heavier, longer, and more painful. And for some women, that can settle after 6 months and the periods can calm down again. With other women, it can go on. So that's what you need to be aware of. Like if you already have really troublesome periods, the copper IUD may make them worse. That's the same if you have endometriosis, adenomyosis. Um, but otherwise, really good option, you know, if that's what you want, if you want a non-hormonal, really effective, fit and forget, I like that saying, you fit it and you forget about it, form of birth control, it's a great option. Just remember it doesn't protect against STIs, you know, that's the other thing. And um yeah, see how it goes for you, basically. I think the copper IUD is great. And non-hormonal contraception is great if you want that. You've mentioned tracking. Tracking, if you track properly, it can be effective. But you can't just track your cycle. You can't rely on that. You have to do more things. So you've mentioned temperature, which is it's called basal body temperature. You have to do it literally every single morning before you get out of bed. As soon as you wake up, take your temperature and track it. And the other thing you can do is look at your cervical mucus. So you can see the changes. And when you're going ovulating, releasing an egg and becoming fertile, it turns into like sticky egg white. And using cycle tracking, temperature, and cervical mucus can be a really highly effective form of birth control. So avoiding sex or using condoms when you know you're fertile, but you have to learn it. Digital contraceptives like natural cycles use sort of those ideas and build an algorithm for you. And again, if you do it properly, highly effective. But my mantra is you only get out of it what you put in. So if you really don't want to get pregnant, you have to put the effort in to keep protected. If you're slapdash with it, if you're not doing it properly, there's a much higher chance of getting pregnant. And you also have to remember that in perimenopause, if your cycle is going all over the place, then it may not be as reliable, or you may have more days where you can't have sex without a condom because it's just not being able to predict your fertile days accurately enough.
Mhm. I'm not a huge fan of the apps because, like you said, they're just an algorithm. They're just a mathematical equation. You can't guarantee they're going to be accurate because maybe you have a shorter luteal phase or something. And as much as I advocate for taking your temperature, use the ovulation strips, look for the mucus, I think there's a lot of body awareness that has to be there for a woman. Like you almost need to be doing this for like 10 or 20 years or a practitioner where you're very skilled in it. Even cervical mucus, a lot of women don't get, not a lot, but women who have low estrogen, they won't see a lot of cervical mucus either.
Mm.
So there's so many like angles that we need to cover back to like women just have been done a disservice. Had we learned this, I'm assuming we're around the same age. If we had learned this in primary school, like when we were 10, 11, 12, not just the sex education, but the fine details, and then
Yeah.
had it reinforced and reinforced all the time, then
Yeah.
you become very skilled and aware rather than just getting your bit of sex education. Then your period arrives, maybe your mom fills in the gap, and then you try learn it yourself over the years.
Oh, absolutely. And we say this all the time, like you need a refresher. So you learn it and you'll like learn about birth control, learn about periods. You need a refresher when you're 18 and you're going out into the world. Then you need a refresher when you're thinking about starting a family. Then you need a refresher in this sort of like chaos phase of life, going into perimenopause. Yeah, totally. I haven't mentioned that we wrote a book. I haven't mentioned we wrote a book to do exactly this, to have like a guide on female health and contraception and how they interplay that you can have and just like go back to it when you need a refresher. Because you can't hold it all in your brain, and every your life changes, you need to learn more and go back over things.
Absolutely. The only reason me and you, well, definitely me, hold stuff in our brain is because we've repeated it so many times. It's
Yeah,
just ingrained in us.
exactly.
But if we were just randomly, like gardening is not my strongest point, but I can do it. I can not kill stuff. But I read one thing and then I've forgotten it a few weeks later. Like it's only because we're constantly wash, rinse, repeat that we remember everything.
Mhm. Yeah, absolutely. I've just realized how dark I look now because the sun's going down in the UK, even though it's like midday your time. Shall I
Well,
turn
we're
a
just
light on so you can see
finishing.
me?
We're just finishing up, so
That's fine.
you still look beautiful. I didn't actually know you guys had a book, so is that over on the website?
Um, I think, well, on Amazon is probably the best place to find it, and it's really originally called Contraception.
Okay.
But it's got everything, it's got everything you need to know about the forms of hormonal, non-hormonal birth control. There's a section all about contraception to get pregnant. There's a section about perimenopause. It's got everything you need in it and about how birth control and contraception like interplay with women's health.
And just making sure you can be informed with your choice. So,
Mm.
Fran, this has been awesome. Is there anything you'd like to kind of leave our listeners with, which are probably going to be primarily women, in regards to birth control?
Yeah, I would say Don't be afraid of birth control. Birth control isn't the devil, but you need to have informed choice. You are an individual, you can make your own choice. Arm yourself with everything you need to make that choice that's right for you, and don't let anyone tell you what you need to do for yourself.
Well, thank you, Fran, for your time. This has been a pleasure. I've no doubt some people are completely confused. One British accent, one Irish accent. They don't know where they're going. Thank you. This has been a pleasure. I hope you have a great rest of the week and we'll chat soon.
Thank you. Take care.